Children of diabetic mothers can present with serious complications if the blood sugar during pregnancy is not well controlled, and these conditions include the caudal regression syndrome, where the sacrum and part of the lumbar spine is missing. It can also cause neural tube defect, such as anencephaly, and finally it can cause transposition of the great vessels. So you know how normally the aorta is coming off the left ventricle and the pulmonary trunk comes off of the right ventricle. These great vessels can swap positions in patients of diabetic mothers. So this would be an example of a caudal regression syndrome. As you can see, the sacrum and part of the lumbar spine is missing, and here would be an example of anencephaly, where the forebrain is missing and thus the fetus has a frog face appearance. Now I would like you to know that uncontrolled diabetes mellitus is what is causing all these symptoms. Now, after the second trimester of pregnancy, usually pregnant mothers become resistant to insulin, and thus their blood sugar can start to rise related to pregnancy, and this is referred to as gestational diabetes. So this is different than uncontrolled diabetes mellitus, which starts from the beginning of pregnancy. So after the second trimester, patients can develop resistance to insulin and develop gestational diabetes. And common complications of gestational diabetes include macrosomia, where the weight of the fetus is more than 4 kilograms, hypoglycemia in the first few hours following birth. So since the mother has diabetes, there is too much sugar, and thus fetus will start to make too much insulin. Once they're born, there's no more high blood sugar from the mother, and thus these patients will develop hypoglycemia for the first few hours of birth until they adjust their insulin levels. And finally, diabetes sometimes interfere with placental vascular supply, and thus due to decreased oxygen supply, these children will develop polycythemia, which causes hyperviscosity. And that concludes our discussion.